We're going to start with welcoming our Mayor, Ray Stephanson, to the floor to give us his welcome and a few words.
Thanks, Joe. Well, it's great to see all of you here. Melissa, I wanted to thank you for allowing us to be here today. Today is a chance to look back over about 2 years worth of work and on your part and give you some updates to what we've been about for the last couple years and specifically over the last 6 months. We've taken the lead on several projects that are part of what we describe as our Safe Streets plan, which focuses on housing, diversion, outreach, and enforcement. And in a minute, you'll hear from Chief Templeman and Hill Kamen, our prosecutor, and David Hall from our City Attorney's Office on the progress on those fronts. I'm proud of the work that we've done over the last several months, and I'm excited to see what some of the next efforts are going to be, including our work crew program, our embedded social workers, and the development of a housing facility. But we still have a long way to go. I'm not sure this journey is ever over, but the positive steps that we're taking have been very encouraging to me. And I think of communities around us that waited until they got into crisis. That's not to say that we don't have our challenges, but I think we have a very proactive plan. You're going to hear about that. And much to my surprise, we have had support from the state this year in an incredibly challenging budget year. We have support and commitment from the county. When I was in Washington, D.C. a couple of weeks ago, we talked with HUD. It was interesting. Here we are with federal HUD folks talking with the representatives from Seattle, many who I hadn't met. So they were probably wondering, what's this guy back here doing? Probably causing trouble for us. But they are very encouraging in terms of what we can do and what resources are out there. But I also, once again, want to thank all of you because this is possible because of you and the hard work and dedication that you brought to this effort and to this community. And the other really exciting and amazing thing that's happened to this process, and I know I've said this before, is the absolute incredible support that we're getting from community. Of all the things that have happened, you know, big stuff and stuff that I have been proud of, like WSU and other kinds of issues, this is the one issue that I've heard more about. As Bob knows, I've even got invited to my church that I should attend more to speak about this. and my wife Vicki was there and she said, gosh, I didn't know you were doing all that stuff. And I said, well, I know who talks at home. It's not me. But anyway, again, thank you. And we're gonna keep you updated as we go through this process. We've got a lot of work to do. We're narrowing in on a piece of property to build our first 60 or 70 units of housing. The support we've gotten from Catholic Community Services, YWCA, United Way, it's just been terrific, and I just can't thank all of you enough. So enough from me. Julie? Sir. All right. Thank you. I'm going to go out and do a little work. I got another meeting, so
all right.
off and running.
Thank you very much. So we are gathering together at the request of all of you, our Community Streets Initiative Task Force members. And in your 2014 final report, you asked that we bring you back together every 6 months for 2 years so that you can get updates. So that is the intention of our time together today. The task force members will have an opportunity to provide their feedback, but we're really not going to open it up to a public process. But you certainly can email me directly if you have some follow-up or any kind of questions that you want. And we appreciate you being here very, very much. So thanks to the United Way, well, I guess I'm Julie Frohnholz. I don't know if I've totally introduce myself, and thanks to the United Way of Snohomish County, I have served as the coordinator of the Everett Community Streets Initiative for the past 6 months. And I'm very happy to be here as a new team member, and I look forward to you all hearing about the work that's being done in the city to address our multifaceted and deeply complex street-level social issues that brought you all together in the first place. I've had the opportunity to meet many of you either in the interview process or shortly after I began in November of 15. And it was important for me to hear from each of you about your experience and the extensive process that you went through during the Streets Initiative. I was inspired to hear your openness to new understandings and your concern for the topics and for the individuals that are affected. I recognize that there was a little bit of disagreement, but I was encouraged to learn that you all felt that it was a worthy experience and one that you're proud of. Alongside city staff and steering committee members, I've spent a lot of time dissecting the strategies of the Community Streets Initiative final report and implementation plan. I've been very impressed to learn how many strategies have been initiated, completed, or have become a day-to-day part of the city of Everett. A condensed status report is available for y'all here today, so please take a look at it and get in touch with me if you have any specific questions. I believe that the Streets Initiative created a shared language that the city and the community were able to take and move forward together. Collaborative relationships among task force members help set a tone for better communication among city departments, businesses, service providers, neighboring cities, the county, and our residents. Community partners have been invaluable to the success of the Streets Initiative to date and will continue to be so in the future. The Streets Initiative process helped the city to shift its priorities to include addressing the street-level social issues. Since the city has continued to learn about the concerns, the needs, and the services available. And albeit we have quality programs, people, and services, the reality is we just don't have enough immediate resources in our county for addiction and mental illness treatment and permanent supportive housing for our chronically homeless individuals. The lack of these resources continue to bring challenges to the streets of our commercial core areas and Smith Avenue. But from what I've seen, I believe that the city of Everett won't give up. It is apparent in the mayor's leadership to his staff, in his public comments, and in the resource allocation that involves multiple city departments to be a part of solutions that best address our street population and homeless residents. And although the Streets Initiative plan was developed with a city lens, it was equally recognized that the county, the state, social service providers, faith-based groups, Everett businesses, and community members are each a part in ensuring positive outcomes. Together, through relentless champions, compassion, communication, education, and collaboration, I believe we do have the will and the relationships to help make our city vibrant, resource-rich, and safe, and that we will see community conditions improve. One step in that direction is in September 2015, the mayor launched the Safe Streets Plan. This Safe Streets Plan narrowed in on some of the specific recommendations that the Streets Initiative process addressed, and that includes enforcement, diversion, and housing. I'd now like to introduce Dan Templeman, who is our police chief, and he will be sharing the impacts that the Everett Police Department is having on addressing our public safety concerns, followed by Prosecutor Hill Kamen, who will talk about the legal landscape and alternatives that are being used for better outcomes. And last, you will hear from Assistant Attorney David Hall, who has led the Streets Initiative efforts and will discuss our work related to Housing First and each of our roles in advocacy. So thank you very much for being here.
All right, thanks, Julie. I appreciate it. First of all, I just want to start by thanking all of you for being here today. Just your presence, obviously, is evidence of how important this topic is to all of us, and that we all play a role in trying to address what we're seeing out on the streets. And so I've been asked to come here today and update the task force on the public safety components of the Streets Initiative final report. And specifically what I'm going to focus on is about 6 or 7 different areas that we've been dedicating a lot of our resources and attention to, and share with you some progress and some success, but at the same time acknowledge, as the mayor did in his opening remarks, that we've got a long way to go. This is not a problem that we're facing today as a community that's going to be solved overnight. It's going to take consistent attention and resources and commitment from government entities and the community. So what I'd like to start by talking about is the Streets Initiative final report had several recommendations that were specifically associated with improving public safety. And I'm just going to go through, like I said, about 6 or 7 areas and provide you updates. The first one has to do with crime prevention through environmental design. That was a recommendation that was made for our crime prevention officer to do additional outreach in the commercial core areas and work with businesses and even private residents, which we have done, that are in some of these areas, to look at their properties and identify areas within the properties that they might improve to help minimize some of the impacts that we were seeing on the streets. So that could be anything from trimming shrubbery to adding lighting on the property, no trespassing signs. If there's a business, and we've had several businesses that are seeing repeat trespass situations where they're coming into work in the morning and finding needles and garbage and other issues. And so we proactively then, if I learn of those or if any of the operations supervisors learn of those, so we'll get our crime prevention officer engaged, and he'll proactively go out to those locations even if they haven't called us. But many of them have called. And so we wanted to really focus on these commercial core areas. And the latest report that I received from crime prevention is that we've done 39 of these SEPTED evaluations in the commercial core areas of the city. That's throughout the city, but primarily mostly in the north end of town, but we certainly offer that service free of charge throughout the entire city. And it's a pretty thorough evaluation of a property. And again, we do it for both private residences and commercial properties. And so 39 of those evaluations have been done. Many of those locations have implemented changes. They don't necessarily always implement all of the recommended changes. Sometimes those come with dollars attached to them. That makes it a little bit cost prohibitive to apply all of the changes, but even implementing several of the changes, or 2 or 3 of the changes that are recommended, has shown to help some of the properties that we're dealing with. So we will continue to offer that service, and again, anybody can request that service by contacting our crime prevention officer, which is Officer Eddie Golden, and his contact information is on our police website, to include his phone number and email. Another area that I wanted to talk about was the alcohol impact area. That was a recommendation that was submitted and part of the final report, the Streets Initiative final report. And really, there's quite a process involved with implementing and being approved for an alcohol impact area. And ultimately, that request has to be approved by the Washington State Liquor and Cannabis Board. And so we spent 6 months collecting data in the area that was identified as the proposed alcohol impact area, which included some of the downtown core and then up Evergreen Way out to South Everett. And we used fire department data to assist us in identifying those areas that had the highest call load of alcohol-related incidents. And we have submitted our application to the Washington State Liquor and Cannabis Board. They're in receipt of it. They've asked for some additional data from us, and so we're in the process right now of working with Everett Fire and our Public Works Department on some mapping aspects of the data that they've requested, and we will have that back to the Washington State Liquor and Cannabis Board by the end of April. And so beyond that, then it's really up to the board to review the information that we've submitted and then ultimately approve or deny that request, and we're optimistic that we're going to have that approved. But I don't have a timeline. The next time we meet, hopefully I will have an answer by that time. Another aspect of the improving public safety portion of the plan involved amending the aggressive begging ordinance, or the aggressive panhandling ordinance, and Hill may address some of this, but we had looked at a lot of different options that were out there. with regards to amending our ordinance. Ultimately, what was approved by City Council in October of 2015 was that we still have, panhandling is still allowed in the city of Everett, so I want to make that clear. We do not have a ban on panhandling. It is still allowed, but you just cannot panhandle in a manner that obstructs pedestrian traffic or vehicular traffic, or panhandle in a manner that is aggressive and tends to intimidate another person. So those are two of the elements of our aggressive panhandling ordinance. The other update that was made to that ordinance was that it is now a jailable offense. It was not previously, but it is now. And again, we use this ordinance only in those situations where it's warranted. You know, where we've got a victim who contacts police, who describes a situation where they were accosted, they were approached, where somebody made a threat. In those instances, we will use that ordinance, but we do use it sparingly. We will also, in the coming months, start working with some of the local businesses a little bit more proactively that are experiencing some of these issues, and working with them on the application of this law and educating them on this ordinance as well as to how it can be used and how it can't be used. Because quite often what we find is that members of the public don't have a full understanding and think that if somebody panhandles, that's illegal, or if somebody, you know, asks me twice for money and I say I don't have it, that's a violation of the law. And there's a lot more to it. And so we'll be working on some public information with regards to that in the coming months, and I'll talk a little bit more about how that's going to occur in a few minutes. Increasing law enforcement presence in the commercial core areas, that was a pretty well-supported recommendation of the task force. And as I reported to the task force early on in this whole process, you know, we are in the process of hiring new officers. I am pleased to say that we're making progress towards that, but we're still seeing retirements. We're still seeing officers leave the agency. And so, you know, we've hired 38 police officers in the last year and a half, which is pretty much unprecedented for the city of Everett. And my goal is this year to hire 25 more police officers. And so we continue to work with the resources that we have, but what we have done since this recommendation came out. So over the last 17 months, we've been tracking our patrols in the commercial core areas and throughout the city. And what I'm going to report today is that we have dedicated 11,710 hours in the last 17 months. And these hours that I'm reporting are primarily in the downtown and the Mission areas and along some of the commercial core areas of Broadway. 11,710 hours specifically to those 2 or 3 locations. And that's from regular duty and overtime patrols that we've been engaged in. This does not include the additional patrols that we've been doing out in South Everett. Because I'll tell you that what we're starting to see is the migration of some of this activity. So, you know, people will say it's highly visible in areas like the Mission, down by the Mission. We have just as much of a problem in other areas of the city of Everett. It's just not quite as visible. And we have crime occurring within some of these camps. We've got individuals that are being victimized. We've got individuals that are preying upon a lot of the homeless individuals. And I'll talk a little bit more about our unit that we have looking at some of these issues and some of the arrests that they've made on individuals that are preying upon some of our most vulnerable people in our community. But 11,000 hours we have had where we have tracked and documented over 7,600 contacts during that time, and over 3,500 business contacts as well during the last 17 months that we have documented. We've also made 538 arrests. And I want to talk a little bit about that approach with regards to presence and with regards to our arrests. I said this 2 years ago when we met, and I'll say it again today because I think it's really important to reiterate this, and that is that, you know, this is not going to be an issue that we will arrest our way out of. And so as police officers and as a law enforcement profession, and not just in Everett, but my peers throughout Snohomish County and throughout the country, are all realizing that we've got to start looking at other ways and being creative in order to address this problem and have a real impact in the community. Now, arrest and enforcement has to be part of it. It just absolutely has to be. But the other part of it is the outreach and the access to social services. And as a department, as a police department, we are committed to that balanced approach between enforcement and outreach. And that is a good transition for me to talk a little bit about the law enforcement embedded social worker program. That was also a recommendation made by the task force. It was probably one of the first recommendations that we were able to implement. And that thanks to a partnership with Snohomish County Human Services. We partnered with them to bring on our first law enforcement embedded social worker. And she's not currently with us anymore, but during the time she was with us, the impact that she had was remarkable. And what was also remarkable was how the officers within our department embraced that change and embraced that philosophy of looking at this problem through a little bit different lens. And that was, as police officers, typically our approach has always been, regardless of what we're trying to build, we'll just use a hammer. And that really wasn't going to work and isn't going to work with this problem. And so I'm really proud of the officers within our department and throughout the county that have really embraced this change in philosophy, which is, yes, we're going to arrest when we need to arrest, and we're going to use the criminal justice system when we need to use it. But when we don't, we're going to look for alternatives. We're going to look for ways to break these people out of the criminal justice system and into a more long-term solution. And so where we're at right now with our law enforcement embedded social worker program is that at the end of 2015 and early 2016, the mayor committed to the creation of a new unit within the police department. It's a new unit that's going to consist of 4 police officers, a sergeant, 2 law enforcement embedded social workers, and then a dedicated prosecutor. And that dedicated prosecutor is not there for the purpose of, necessarily prosecuting, but there as a representative from that office. And Hill's going to get up and talk a lot about the alternatives to jail that we've been looking at, and some of the new programs that we've established that I'm really excited about. But this prosecutor will help take some of these individuals and navigate them through that system. So if they're not a good candidate for the social services piece and they need some law enforcement and criminal justice attention, then that's the route that they'll go. But if we can take them that other direction and they're willing and they're able, we're going to look at that, and that's where that prosecutor will come into play. But this new unit not only will be visible throughout the city and throughout the commercial core areas, and will not only be looking at some of this outreach, so some of the diversion opportunities that exist now within the city that Hill's going to talk about. This unit will be able to direct some of these individuals into those services right away, along with social services, with the hiring of the 2 new law enforcement embedded social workers. But we'll also conduct undercover operations and enforcement, drug enforcement. That seems to be at the root of all of this, is the heroin, and also a resurgence in meth, and we're seeing spice again, surging again out on the streets. And so this unit is going to kind of take that multifaceted approach, and it's not going to be just a hammer to everything. It's going to be some outreach. They will work with these businesses on SEPTED, work on these businesses on educating them on the aggressive panhandling ordinance, and again, be highly visible within our community. Last 2 items I wanted to talk about. One, it has to do with the task force report. The other one isn't, but it's a program that I do want to at least talk a little bit about. The recommendation of returning inmates and other dislocated individuals to their place of origin or relational support. One of the topics of discussion during the task force was had to do with the jail and had to do with all these inmates, or the perception that inmates were being released from the jail from other communities and they were ending up on our streets. And I can say that to a certain degree. I think that was true, that there were some that were ending up on our streets. I know that our officers would occasionally contact some of these individuals. As a result of this and a lot of other discussions, and the sheriff certainly understanding the concerns that that the Everett community had. The sheriff did terminate all of the out-of-county contracts. I think there were about 17, maybe 13 to 17 out-of-county contracts that the sheriff did terminate, and that certainly had an impact on what we were seeing on the street in terms of some of these individuals. Now, we still have agencies, jurisdictions within Snohomish County that use the Snohomish County Jail, and those individuals occasionally are released from the jail. I do know that the jail does their best to try to establish and identify a transitional plan for these individuals when they are leaving, to try to arrange for transportation for them. It doesn't always work, but I know that is something that we have made a priority of, and expressed that to the sheriff, and he has done his best to try to put in place whatever protocols he can to get these inmates back to their places of origin or where they have support. One of the things, and I'll just mention this, that they did do, they canceled all the contracts at the jail. They did reinstitute one contract with the City of Seattle. And I know that David and Hill were involved in a lot of these discussions. The difference this go-round was that we were at the table with Snohomish County to talk about this issue, about how do we ensure, to the extent that we can, that these individuals that are being housed in Snohomish County Jail that are from City of Seattle are not released in the City of Everett. And I'll certainly let them talk more about it if they'd like, but my understanding is that the sheriff and the county was very open to that, and actually have a system in place right now that pretty much guarantees that these inmates are returned back and then released from Seattle. Again, we're not going to say 100%, but for the county to actually sit at the table with us and engage in that conversation and understand the concern that we have as a community in Everett about these individuals who their support may be 30 miles to the south, and they're being released on the streets of Everett with no support. The county certainly understood those concerns and are working with us. The last thing I want to talk about was not part of the report. It is, though, a program that I'm very excited about. When we talk about law enforcement looking at this issue from through a different lens, this program fits into that philosophy. We hope sometime by the end of May to officially launch this program, but we have unofficially been involved in a program called PARI, which stands for Police Assisted Addiction Recovery Initiative. And what that really is where law enforcement teams up with a group of different treatment providers, drug treatment providers throughout the country. And most of them are located in other states, not the state of Washington, because we really don't have many of these treatment facilities, but some of the other states, California, Arizona, Florida, have a lot of these recovery centers, and these are high-end, nice recovery facilities. And what this does is that it allows us as law enforcement, if these individuals come to us or they're ready to say, I'm done with heroin, I want some help, they can come into the police department. If they have drugs on them, if they have paraphernalia on them, we'll take it, we'll discard it. They will not be charged with any crime. And then we will facilitate getting them into treatment. And so again, we've already facilitated 5 different individuals from Everett, some of them who have been on the streets for years, some of them who've been down in the Mission area, some of them who've been in other parts of the city, homeless, addicted to heroin, other issues too, maybe suffering from some mental illness and other issues. But we have facilitated getting them into treatment, long-term treatment, and there's no expense to the City of Everett for this. These treatment providers are scholarshiping these individuals if they don't have insurance. Now, if they do have insurance, then the insurance covers it, but we still will help facilitate that. And we have partnered up with Providence Hospital and to help with detoxing some of these individuals, because we have to get them on a plane and transport them to some of these other states where these treatment facilities are located. And so Providence has been an excellent partner for us to help us get these people stable so that we can get them on a plane. We've established a flex fund through the city, and thanks to Julie and some of the work she's been doing and some of the community members and organizations that have contributed to that, which will allow us in those certain circumstances to purchase a plane ticket if we need to get these individuals to treatment. They're picked up on the other side by the treatment provider and brought into treatment, and we're going to continue to work with this program. And again, we hope to officially launch it sometime towards the end of May. But that was not part of the Streets Initiative recommendations, but it was a program that we learned of, and one that, again, when you talk about being creative and thinking outside the box and doing things that traditionally law enforcement has not been involved in, this is one of those. And so with that concludes my report, and I'd like to turn it over to Hill.
Thank you, Chief. I'm Hill Kamen. I'm the lead prosecutor for the City of Everett, and I'm going to be talking about the alternatives for better outcomes. And this falls under the umbrella of diversion. The mayor's Safe Streets plan includes enforcement, diversion, and housing. And diversion is any, from a prosecutor's perspective, it is any program which says to someone, if you participate in a program that addresses the underlying behaviors that contributed to criminal activity, housing, drug and alcohol treatment, mental health treatment, then we will hold off on filing charges or give you a better deal in exchange for doing this program, because that program will address the underlying issue that led to your conduct. And you can't think about diversion without also understanding the other prongs of the Safe Streets plan. Because in order to back up a diversion program that works, you have to have enforcement. So we often say to people, if you go to treatment, we won't prosecute you, but if you drop out, then you're going to go to jail. And without that consequence, it's hard to drive people toward those diversion opportunities. On the other end of the spectrum is diverting to what? And without a robust mental health, chemical dependency, housing services within our community, we cannot operate functioning diversion programs within the criminal justice system. Because we can say to somebody, go to treatment instead of jail, but if there are no treatment opportunities for that person, then a diversion program doesn't work. And so these three prongs really need to work together in coordination and be part of a comprehensive and balanced approach. Within the world of diversion, there also needs to be a spectrum of diversion options for individuals. What we have really learned through this process over the last couple of years is that there is no one single program that is a good fit for everybody who we see coming through the municipal court, or any court, in fact. Some individuals can participate in our mental health court called MAP, but that is a 12-month minimum program. You have to have a lot of interaction with the court, a lot of interaction with your treatment. You have to be functioning at a level where you can participate very much in your treatment. On the other end of the spectrum are individuals who are not even capable of participating in a program like that and need a program more like our CHART program that I'm going to talk about in the end. And what has been helpful for us in knowing where an individual goes is the ability to use data. Data to identify those people who need to be in an appropriate program, and also data to understand if what we are doing is actually working. Because at the end of the day, we want our diversion programs to make the community safer. If jail worked and made the community safer, which it does in the short term, and it does for some people, but when you're talking about addressing issues of chemical dependency, mental health, homelessness, jail is not a long-term solution. And at the end, I'm going to invite Robin Fenn up to talk about some of the initial data that we've learned through our CHART program and shows the successes we've been having there. So the first update that relates directly to the Streets Initiative is about our MAP program, the Mental Health Alternatives Program. This is a court diversion program. It is currently being reviewed by University of Washington to evaluate its effectiveness, but really rough numbers. If the first 11 participants, they had a combined over 100 arrests prior to entering the program. Since they left, there have been 2 subsequent arrests of those 11 people. And so that initial look at the numbers shows this program works. It works because it gets people in an environment and it says, we're going to work with you, we're going to stick with you, we're going to have consequences, and we're going to help you get into that treatment that you need. I'm really excited. One of our graduates is here this afternoon, Gene Martin. I hope I'm not embarrassing you, but he was a guy who I prosecuted many times, went through that program. He just told me today he got a job, and he's doing great. And I never see him anymore. I got to see him at these events if I want to see him. And he's also graciously agreed to be part of the Streets Initiative Steering Committee, and that addresses one of the recommendations was to get input from individuals who were formerly homeless. I just left. We had a MAP graduation this afternoon. A young man who had a psychotic break about 18 months ago, scared a lot of people down at the transit center, was spent 2 days in jail, and then entered into our program. And to watch somebody work through the process, want to quit halfway through and say, Judge, you're not telling me what to do, and for the whole team of public defenders, prosecutors, judge, treatment people to circle around him and say, hey, we believe you, we will put you back in jail, but we don't want to, and watch him get through that and then go 6 months of really not the same person he was before. Wants to go to treatment, wants to be part of the program. It is one of the most rewarding experiences that I've ever had being a prosecutor. So this program really works, but it's not for everybody. One of the next program, one of the recommendations was a work crew program. And that was a recommendation of the Streets Initiative. It was also one of the programs that the mayor had in his Safe Streets plan. And so beginning at the end of last year, we started our planning. We contributed to the chief's retirement problems by grabbing one of his retiring officers, Officer Jack Jessup, you might know. He retired after 32 years, and he is now supervising our work crew program. So the way this works, we saw that there was a group of people who were being contacted by police on the street who were not doing well or not good candidates for some of our other diversion programs. Okay, we have a lot of diversion programs that I'm not even going to talk about today. Some of these you have to have a certain amount of stability. These were folks who were homeless, on the street. They needed some immediate diversion. And so it was important in developing this program that this is something where a person could commit a crime and be offered the opportunity of diversion at that moment they interacted with the police. So working with this specialized team that's not fully up yet, but with a limited group of officers who are out doing outreach and enforcement, they now have the opportunity to say to an individual who has just trespassed on a business property, just had drug paraphernalia, some low-level misdemeanors, they say, instead of going forward with this prosecution, you can enter into a work crew program. They then show up within 24 to 48 hours. We've partnered with the Everett Gospel Mission. They provided us space. They're washing our uniforms, and they're helping us out provide lunch for these individuals. They meet there in the morning, and then they go out throughout the area along the Broadway corridor down to the transit center, up to, I believe, about 19th or 20th along Broadway, picking up garbage. The first guy, we had one guy on day one, picked up 8 bags of garbage all by himself on his first day. They had a guy there yesterday, he picked up 12 bags of garbage. He said, man, do I have to commit a crime to get into this program? It's really early. It's only been up for 5 or 6 days, but the people who are doing this, we have about 5 people show up. They can't even believe they've had this opportunity to participate in this program. They're going to get mentoring, they're going to get lunch, they're going to get an opportunity, and they're going to take responsibility for those areas where they contributed to the problem and the garbage and the waste that we see there. So it's a great form of community restitution. It's just starting up. I know when we come back, I'll have a lot more to update about that program. The CHART program, I know I've talked about that quite a bit. That is a program, Chronic Utilizer Alternative Response Team. So we had a group from police, our office, fire department, social service, Snohomish County Human Services, and Providence. And initially, it was just those groups, and we were in a room, and we were trying to figure out who are these people who use the most resources? And is there a way in which we can reduce their impact on our system? And so that group has identified now 15 people. That may not sound like a lot, but these 15 people have such a disproportionate impact on criminal justice, emergency room, fire department, that they inhibit our ability to deal with the other people who really need to be in those systems. And so if we can have an impact on them, we're going to have a big impact on the system as a whole. And that's why when you just talk about 15 people, it may not seem like a lot, but it really does have an important impact. What we didn't have 6 months ago was a team of social service and housing providers in the community who needed to be at that table. So what we've done is we've reached out, we've gotten those groups to come in, and now we had a meeting this morning. There are about 30 people in the room who provide housing, treatment, mental health, support services. And we sit down and we talk about it, and we find ways to get people into housing, get people into treatment, and we don't stop until we've done it with somebody. And I'm going to let Robin in a minute come up and talk about the results of that, but they're very encouraging results. Looking off into the future, I know there was a recommendation in the task force to focus on 18 to 24-year-olds. And I know I've talked with Cassie Franklin about this. I went and looked at the Everett, in our office, so we prosecute 4,500 cases a year. 20% of those are for individuals who are 18 to 24. And so as we look forward into what kind of diversion programs we need to build into our system moving forward, that is a population where we want to prevent those chronic utilizers in the future from staying in the system longer. And so as we begin to evolve and think and look at what works, that's going to be a target of our efforts so we can begin to have an impact down the road. Two final things I want to talk about. Three, really. One, I just got to reiterate the issue of drugs is such a part of what we're seeing when we talk about street-level social issues. When I read these reports, when I read about the people who've been arrested, so often it is individuals who are facing drug addiction. And so this has to be part of our conversation on how we address this in the long run. You know, we've been enforcing against those individuals who don't want to participate. There are lots of people who we offer these programs to who say, I don't want to do it. And it's important that we continue to have that tool of jail. The jail has been very cooperative with us, with these individuals who are out on the street. We've actually increased our jail time for those people who refuse to participate in diversion opportunities. We want to have that sanction. We want to be able to use that in an effective and a smart way. Chief mentioned a couple of legislative changes that were made with the aggressive panhandling ordinance. We also had a challenge to our camping ordinance. And what I will say is that these ordinances that address what is seen on the street, the legal landscape that is out there right now is that the pressure is to not use these ordinances. And it is very important that we have the tools to address the public hazards that are in our community. I mean, if you go into some of these camps that are out there, it is despicable. It's unacceptable that we have human feces and needles and rats and garbage to the level that we have. And it is important to our community that we continue to have tools to address these. But we want to have a full spectrum of tools. We want to have the ability to enforce against those people who don't want diversion. We want to have diversions to help motivate people into services. And we need, from the criminal justice system, to have a strong, robust mental health, chemical dependency housing system so that we have some places to send people to when it's more appropriate. So with that, I'd like to invite Dr. Robin Fenn up to report back on the initial evaluation of our CHART program. And I thank you all for being here.
So I don't know if I'm more excited to give you the initial results of this or if I'm more excited that the chief of police used the word data 9 times in his presentation. So thanks, Dan. Pardon?
But who was counting?
Who would count, Bob? I'm Robin Fenn. I'm the research manager over in Human Services. And when the CHART program initially got started, I remember sitting there having conversations with David and Hill, and I said, oh yeah, so what? So how are you going to know you were successful? So somehow I ended up at that table, and so starting to take a look at things. One of the biggest things that came out of this, and I know these words don't come out of my mouth often, that was impossible to measure or to quantify, was the collaboration piece. People say that collaboration moves at the speed of trust. We had leadership from the hospital, from Providence, from the city attorney's office, from human services, from fire, from police, from everybody who sat there in a room and said, you know what? To hell with the power issues, to heck with all of this, what do we need to do to get stuff done? So that collaboration piece, and like Hill said, having 30 or so providers sitting there saying, what do we need to do to work together to make things work, and giving up their pieces of the silo is huge. I can't quantify it yet, but it's huge. So the initial evaluation of this, we have about 6 months of data pre and 6 months of data post. So I've used the analogy before. You go on a diet on a Monday, and Tuesday morning everybody says, oh my God, how much have you lost? We need to give it a little bit of time. So for our first 6 people that got enrolled in CHART, we took a look at their contacts with Everett Fire and with EMS across the county. We took a look at their referrals to the triage center, their stays at the Evergreen Mission, their arrests from Everett Police, their arrests from other law enforcement in the county, the number of bookings into the jail, and just Snohomish County Jail, and the number of jail days. And what we found when we took a look at the 6 months before they got involved in the CHART program and the 6 months post was there was a reduction in their contacts with just Everett Fire EMS by almost 81%. Their triage referrals went down 100%. That's all referrals, not just the ones from law enforcement. Their stays at the mission went down 67%. The number of arrests just by Everett Police Department went down just shy of 81%. Bookings into the jail went down 90%, and the number of jail days, this was huge, went down 92%. For these 6 individuals collectively, prior to their enrollment in CHART, they had close to 540 days in jail, just in the Snohomish County Jail. After they were involved in CHART, it went down to 43. I was in a meeting earlier this morning with the sheriff, and I said something, and he said, you know, there's this whole city revenue thing and everything going on. These are the folks that require a lot of jail resources. They're the ones that have some mental health issues, that might be detoxing, that have medical issues. And so these are not general population folks. These are folks that are hitting up the large areas of the system. So therefore reducing some of the risk attributed to the Snohomish County Jail as well. I can see faces, and I worked with so many of you on so many projects, and everybody's going, oh yeah, Robin, what'd we save? What'd it cost? Show me the money. Cost data is extremely tricky. I had a conversation with the chief this morning and said, you know, how do we start working on getting, what does it cost to arrest somebody? What does it cost to take out a fire truck and not transport somebody? What does an emergency room visit cost? And you start getting into things like the questions back to you. Are you talking billed? Are you talking allowed? Are you talking charity care? Are you talking what the actual cost was, what we wrote off? How do we figure marginal costs in? All these kinds of things. So we don't have cost data yet, but I can tell you I've had a number of conversations, and there is collaboration moving forward to make sure we can get the best that we can around these pieces. We're still in the process of attaining all the emergency department visits through Providence. We've seen some initial reductions there. We're running through some of the data on that. So we can also say too, and I can say next time, show you the exact percentage of reduction there is in those visits. But when we keep people out of the emergency departments, our jails, away from our police, away from our fire, like was stated earlier, that frees up those resources for the people who need to be there. That's all I got. So what questions do you have? That was easy. Thanks.
Bring it home, David.
Hi, I'm David Hall. I'm with the City Attorney's Office. And I'm going to talk very briefly about the city's Housing First efforts. That's providing some low-barrier housing is the third prong of the Mayor's Safe Streets Plan. Also, a priority recommendation of the task force report was expanded use of the Housing First model to provide low-barrier housing for chronically homeless individuals. And this is an area that I think of all the areas we've tackled is extremely exciting and extremely important. Before I get into that, just a brief reminder. I know a lot of you have heard a lot about Housing First, what it means, low-barrier housing. But for those of you who haven't, just very briefly, Housing First means exactly what it says. You provide people with housing first. The traditional housing model requires that people be made housing ready before they move from a shelter through transitional housing to permanent housing. Under the Housing First model, you stand that on its head. You provide people with housing first, and then begin to work on problems they may have with mental health or chemical dependency, other issues, medical problems. Low barrier simply means that you don't have those barriers to putting them into housing first. You don't require somebody to engage in mental health treatment. You don't require somebody to complete chemical dependency treatment before you get them into housing. So why is this so important? First of all, it is an example, I think, a good example of the sort of holistic approach that was so important to the task force. It is not just providing housing, it is providing housing in a way that is intended to address other issues the task force identified as extremely important to the street-level social issues we're seeing, specifically mental illness and addiction. And it really epitomizes the notion of cross-silo collaboration that we talked about so much on the Streets Initiative. It has arisen with support from the police department. We have worked with prosecutors, with EMS, with Snohomish County Human Services Department, with the county council, which has set aside $1 million for low-barrier housing in the county, with Everett Housing Authority and other housing providers. It really has been a model of collaboration so far. It's also the area in which I think we've done the best job of public education, which was a very important goal of the Streets Initiative. We have held 2 housing forums. The number of people in this room I recognize were at one or both of those. We brought Lloyd Pendleton in from Utah, a nationally known Housing First advocate. We had 350 people present. We've gotten a lot of media coverage. Some of you may have seen the feature article in last month's City Vision magazine, the magazine put out by the Association of Washington Cities, focusing on Everett's Housing First initiative. So we've done a huge amount, I think, of public education and raising public awareness of what this housing is, what it does, and why it's important. And thirdly, I think it's important because it is in some ways a new model of going about this. We have Mayor Stephanson, a high visibility mayor in our state, who has stepped up and really championed this idea. We're hearing from providers and from legislators that having a mayor out front in this kind of initiative is unique and potentially uniquely effective as we try to get some of this housing built in Everett. So what specifically have we been up to? We have been on sort of 2 tracks. First, we are trying to get 20 people housed quickly in scattered site rental units while we are trying to build a capital facility, which obviously takes time. We have worked with the city and county councils to reallocate some federal home funds to be used for tenant-based rental assistance to get these first 20 people in scattered site rental units. We increased our human needs funding by $105,000 this year at the city and used that to enter a contract with the YWCA to get people into housing and to provide the supportive services they need once they're in that housing. At the same time, we are pursuing a capital facility. We want to have built a 70-unit standalone dedicated facility with on-site services and 24-hour controlled access. It's just a fact that a lot of the individuals in this population are more likely to succeed in this kind of facility because of the on-site services, because of the controlled access, than they are in the scattered site rental units. Some folks will be successful in scattered site units, but a lot of folks will have a lot better chance of success in a dedicated facility like this. We are making very good progress towards this facility. The city is providing city-owned property, which is always a major step towards this successfully completing a project like this. We have successfully lobbied the legislature for money from the supplemental budget this biennium. They set aside $6 million for 4 sites, specifically including Everett's. I met with the Department of Commerce yesterday to get some clarification on how they're going to dole that money out. The city is going to get at least $1.5 million of that $6 million, and very likely more than that. The county has set aside $1 million in their 2016 budget for low barrier housing in the county. It's a competitive process. We've applied for that money. I don't know how much competition we have. I'm actually on the board that makes the recommendation. I had to recuse myself, so I know less about that process than some other people in this room do. I'm looking at Mark Smith. But I think that we have a very good chance at council approval of much of that $1 million to be used towards this facility. We've been working with Catholic Community Services of Western Washington to help kind of develop the concept of this project. We'll go through some kind of competitive process before we transfer property and give money away to a developer. We've worked with them because they have a lot of experience in this kind of housing. They've developed about 30 of these facilities around the state over the years. They've been a tremendous help, but we will go through a process here in the near future to make a final selection for the housing provider and for the service provider. I was supposed to talk a little bit about advocacy as well as housing. I know that was a pretty quick overview, and I can answer some questions at the end if you have them. But we've been pretty busy on the advocacy front. The mayor's held 2 all-county meetings for the mayors and city managers of the other 16 Snohomish County cities to try and start putting together a coalition to make progress on a county-wide basis. I mentioned the housing forums that we've conducted. The mayor and our public affairs director were back in D.C. last week meeting with HUD on housing issues. I mentioned the state legislative effort, which is very successful in the county. And we've had the governor here for an afternoon. And recently, I and representatives from a dozen other communities around the state were in Olympia to meet with the mayor on housing issues. And Mark Smith and I went down and testified in front of one of the committees earlier this year. So the city, I know a lot of people in this room have been involved in advocacy and involved in the housing world for years, toiling in the trenches. What's exciting to me is that this effort that you've all been involved with and with the mayor's leadership has propelled the city into the housing world, which traditionally we've been involved in only indirectly as a pass-through agency for home and CDBG funds and by virtue of our land use authority. But we are now taking a very active role in trying to bring this important form of housing to our community. It's exciting. So that's what I have for you.
Hello, my name is Chris Adams. I'm one of the task force members that participated in the recommendations and the work, and I volunteered to be in charge of the feedback from the task force today. So I wanted to just start that off with saying thank you to the presenters. I mean, it was kind of an update on speed. I was thinking about our first update at the 6-month mark and the 12-month update, And I feel like we're really starting to get a lot of meat behind the updates. I was going to ask a question about measurables, Robin, and you certainly hit it on the head, I think, in terms of really doing some great work and probably some great work to come to in terms of actually putting some numbers behind the progress that's being made. So thank you for that. Just a couple quick comments that I'll start out with, and then I'll open it up to other task force members. One of the things that I was concerned about, and I think a lot of task force members were concerned about when we first put the report together, is that it wouldn't evolve, that it would be sit on a shelf somewhere, it'd be a list of recommendations, 63 of them, and then what would happen. And we walked away, and I think a lot of us thought, well, geez, we should have talked more about drug issues, and we should have maybe spent more time on specific issues. And I think one of the things that really struck me in terms of the updates that you gave today was new programs like you're talking about that the police department's doing, and how important those things are as we look at the evolving problem in our community and new ways to deal with it. So thank you for what you're doing. You know, and Hill and Robin, just to follow up again on the measurable part of it, I think, you know, when you have that data behind it and the work that the CHART program's doing, I think it's really compelling in terms of watching the progress and being able to say that we are really making a difference. Because I think that was one of the real concerns. I think it came up at the last meeting of the task force that we had, is how are we going to measure this? What do we look at 6 months, 18 months down the road? And I really appreciate the work that you're doing in the CHART program. I think that's really remarkable. So at this point, do we have a separate microphone that I'm going to take around to task force members? Or, okay, I'll invite them up then, so that way we get it on the microphone. Or you can repeat the questions. Okay, we'll do that. So I'll open up to task force members. Is there, Cassie?
Well, I want to echo what Chris said, that I'm so pleased that this didn't just sit on a shelf. I think lots of us were worried about that and the extent of recommendations that we came up with. And it's just, I continue to be impressed. I have the honor of working both as with my Cocoon House and task force hat, and then also on the city side, and seeing some of this work firsthand that the city is engaged in, and it's truly impressive. So I think, you know, we can all be really proud of what we've accomplished. I think that we've seen extraordinary efforts. The city and leaders and law enforcement have really been taking extraordinary efforts to address this issue, and I think that what's going to be important is that continued coordination. I think Julie has done an outstanding job of really conducting and helping us. You talked about collaboration and how important that is, and how that's not immeasurable, but that's really kind of core to this continued success. And I think that's going to be really necessary moving forward, that collaboration that we've built from the task force, and that we continue to have that as we're engaging new and different systems, and that we have that coordinator that can lead that work. And I think that something, it's not a question that I have, I get a lot of this information, but I think a lot of our citizens have this, and I know some of my neighbors really, when we see the issue that remains on Smith Street, we know how much work is happening, the number of arrests and diversion and the housing that's being provided. But when we see the problem kind of continue to be so apparent, especially in the Smith Street, what can we do around education? How can we, how big would this issue be if we weren't doing all these actions? It would be huge. It would have gotten out of control. So it's only through these extraordinary efforts that we've been able to kind of maintain, and really, I think that as Chris said, the first couple updates, it was really slow going. There wasn't a lot in place, and now we have so much in place. I think we're really going to start to see a shift that we haven't seen yet. So I just wanted to thank everybody that has been working so hard. Chief Templeman and Hill and David, you guys are amazing. And Julie, thank you for being the conductor behind the scenes and coordinating all these systems. It's really impressive. So, yeah.
Thank you, Cassie. Yeah, go ahead. Yeah. Oh, sorry.
I think our community and county should be proud of themselves for welcoming and inviting the experiences, the ideas, and the best practices of the other communities and cities that have done this ahead of us. I think it propels us and accelerates our position to meet with where they're at already without having to reinvent the wheel, and saving us a lot of time in the long run. So again, congratulations to us.
Thank you, Glenn. Any other comments? Feedback? Are there questions too? Yeah, Ed?
Ed Peterson from Housing Hope and HopeWorks. I was one of those that was very concerned about the shelf I've been on lots of task forces over the last 30 years in this community. Generated lots of recommendations, and I am so impressed with the momentum that's been achieved in 18 months. 63 recommendations, that's a lot to look at and to digest and to figure out how to mobilize. And I'm impressed with how many of them have been, and the degree to which the recommendations have been analyzed and followed and used as a template for how to move this work ahead. I think the momentum is a key, and I've used that term regularly in my own work and in this process, that once you get the momentum going, all of a sudden people want to be a part of it. And I think it's still a task at the community education level that we need to engage the public will that's needed to finish this work, to move it ahead, to advance it. That public will is going to be needed because one of the biggest challenges facing us is capital development. This problem isn't going to be solved by moving the puzzle pieces around or just collaboration. Because when you have people collaborating that don't have the resources with which to provide services and treatment and the like, you end up getting frustrated, and that frustration can be a deterrent to confidence and action. And so this momentum we have being accomplished, I think, is being nicely articulated by the city. And I applaud you for that. The little brochure that you had in the packet today was a good example of how you are sharing ways in which we are moving ahead on these issues. But capital development is one of the key items. We've known this for decades, that we don't have enough housing to address the needs of the various populations that end up on the streets. We deinstitutionalized the mental health system and didn't put any housing in place. We don't have adequate resources and facilities for the drug addictions, and the drug issue is probably one of the key areas now for us to zero in on, because we have an epidemic going on, not just in our community, but nationwide. And it's a big factor in the population on the streets. And we need a strategy and an action plan that can address that. So capital development, drug issue. And then the other one that comes to my mind that I think we need to work on is the day program. A place where people can be in the daytime, where they can store their things, where they can get showers, where they can get food, where they can be with people that they can talk to, where the service providers can connect with them. An organized and coordinated day program is desperately needed. Delighted that the food service providers are meeting monthly and looking for ways to coordinate. I think we need to ramp that up, because there's a lot of people in this community that want to be a part of a solution and want to work together and want to help us figure out answers to this, and they could be mobilized in ways that could help us, particularly I think in this day center, day program, and feeding part of the program. So those are my three things: capital development, drug plan strategy, and day programs. And I think we've got the momentum going that we're ready now to move into these other areas. Keep up the good work.
Thank you, Ed. Any other comments, feedback, question? Yeah, Megan.
Megan Dunn, I was a member of the task force. I also have three things. First, a thank you. I did a little behind-the-scenes advocacy work. So I'd asked task force members to sign on to a letter asking for support to the state legislature for money towards homeless programs, and that was last year. So I'm happy to see that hopefully that had some effect. And then when the first round of the budget came out, it did not include the city budget. It did not include anything for homelessness. So again, I asked task force members to write letters, and I was thankful and thank you to those members who wrote letters. My second thing is we had signed on to a minority opinion around the begging ordinance. And what I'm concerned about is the way that it's written. The task force spent a lot of time talking about punishment and how the punishment should not change. And so in the end, the punishment did change. And then secondly, within that ordinance, it says, well, it's going to be tested. So it's going to be tested coming up here on a night in October, because I know for a fact that thousands of children will be using our public streets. They'll be using aggressive language, saying trick or treat, and they're going to be demanding goods and services. So as I read the policy, you have outlawed Halloween. So I think we might need to deputize some people to be able to enforce this and to possibly incarcerate thousands of kids. And I'm making light of it, but it is very difficult to enforce the ordinance as it's written. And then the third thing is that I think we need temporary housing, and I think we need to look at a tent city as a way to have amenities and storage and humane, safe sleeping conditions for people on the street. Another solution that Seattle did was safe parking areas, because we know people are sleeping in their cars and they're coming into neighborhoods. So if there's a place where you can park safely and have amenities, then that can keep our streets safe. Thank you.
Thank you, Megan. Any other feedback or questions from task force members? All right. And I know you have your hand raised up there. We're not going to open up for public comment, but. So I appreciate the comment. If you wouldn't mind putting something in writing, and we'll circulate it among the task force, I really do. We're not going to open for public comment right now, but thank you. Any other comments or questions from task force members?
Public comment.
Well, there's city council meetings. There's plenty of opportunities for public comment.
When will you have public comment at this task force?
I appreciate that we had a public hearing when we did the process. And so at this point, all we're doing is doing updates and providing a forum for the task force members to provide feedback. So I appreciate the question, though. So at this point, I'll turn it over to Julie.
At this point, we actually are going to say thank you again to each of you for attending today and giving us the opportunity to give you an update. I think Ed kind of encapsulated that we do still have a lot of work left to do, and certainly I look forward to finding more opportunities to learn from all of us together as we move forward. So thank you, and we'll be in touch again.